everybody here? Can they hear me? So anyways, welcome. My name is Mary Ella Jordak, and I'm a member of the Sunday Supper Committee. It's my honor and privilege to be emceeing today. This is a very special gathering and a little different from our past discussions that we've held. Today is our Youth Behavioral Health Forum, and we have not only all of you fabulous community members here with us, but also an absolutely incredible panel of local specialists. On behalf of the Sunday Supper Committee, I'd like to say that we are so glad that y'all could make it. We hope everyone had a safe and restful winter holiday and that you've been successfully navigating whatever new challenges and opportunities that this new year has brought. We always start our Sunday suppers off with a little bit of history and the information on the aims of these gatherings. Our mission is a pretty simple one, and that is to enhance racial understanding, awareness, and respect through open conversation. We recognize that the health and well-being of our youth is always an important facet of our community, but it's been especially critical to turn our focus towards it lately while we are living in such unprecedented times. The Sunday Supper Committee was formed in 2016 as a spinoff of the Equity Committee. Since then, we've hosted both in-person and online conversations. While they are open to the general public, we've also purposely reached out to county lawmakers, educators, students, law enforcement, the Latinx community, the faith-based community, leaders in sports and recreation, and all sorts of other groups so that we can have a diverse and representative attendance. For our past in-person events, we've had smaller table groupings to provide a meal so that guests can break bread together. We then usually move into facilitated conversation with questions or prompts and reconvene to share with the whole gathering what we've explored and discussed. Our format for today is a little different from our past online discussions, but it's pretty simple. I've got a few more things to go over, and then I'll be passing the mic on to our experts to present on a few different topics under the umbrella of youth behavioral health. After the presentation, we'll have time dedicated to your questions for our panel. As we go into the presentation portion of the forum, I'd like for everyone to keep in mind that we are here to build relationships and to strengthen our community. We are all here to learn. Mistakes will happen, and that's okay. We may have to navigate conversations or topics that are uncomfortable to us, and that's also okay. However, bullying or hate speech or aggressive behavior that undermines the ability of the group to communicate with honesty and respect will not be tolerated and will result in removal from the forum. We ask that you please keep your microphones muted during the presentation, and if you have any questions related to the presentations, please submit them into the handy dandy little chat window. Remember that your presence here actively helps to build our community into a stronger, better place for all, and we are glad that you made it. So now it is my very great pleasure to introduce our Rockstar panel. First up is Doncella Wilson, so everybody say hey. Doncella is a native of Queen Anne's County, having graduated with the phenomenal class of 1993. She is a licensed master social worker with over 20 years in the human services field. She is the co-founder of Naryah's Dream Alliance, which is an incredible organization that works to transform the lives of youth, families, and communities through education, resource development, and community engagement. Doncella serves on numerous state and local boards, such as being newly appointed to the Governor's Commission on Trauma-Informed Care. She seeks to live her life as the Maya Angelou quote states, "When you learn, teach. When you get, give." Next up, we have Eboni Taylor-Tue. She is with Midshore Behavioral Health. Eboni currently resides in Queen Anne's County. She's married to Paul too, and together they have 4 children. She is a licensed clinical social worker working as a behavioral health therapist with Eastern Shore Psychological Services. She's also the clinical supervisor for the Chestertown site at ESPS. She's been in the field for 20 plus years and enjoys helping people get well. She is a board member for the Midshore Behavioral Health and works part-time with the Eastern Shore Mobile Crisis. When she is not working, she volunteers her time as the founder of a youth mentoring program for girls in Kent and Queen Anne's County called Operation Glow, which is Girls Learning Our Worth. She believes it takes a village to help raise our youth. Next up, we have Brandi James. Brandi is a crisis intervention coordinator. She is employed by Eastern Shore Crisis Responses Services of affiliated Sante Group and has been conducting CIT trainings for the last 7 years with law enforcement. Ms. James lives in Caroline County with her husband and 5 children. Next, we have Yolanda Acree. So everybody say, hey, Yolanda. Yolanda is a community historian and collage artist. She's a native to Caroline County. Yolanda is also the program coordinator for the Queen Anne's County Community Mentoring Program and with Naryah's Dream Alliance. Pardon me. And last but not least, we have Naryah Miles. She's the owner and lead clinician at the Wellness Center. She is an alumni of both Queen Anne's County High School and Salisbury University. Her personal focus is on trauma, anxiety, addictions, and studying dialectical behavioral therapy techniques. She strives to be a voice for the voiceless and ultimately eradicates the negative stigma on mental health. So I am going to pass the proverbial microphone over to Doncella here and let her take things away.
All right, thank you so much, Naryah, for that introduction and just hearing all of the great information from my colleagues. I just want to say, shoo, it's a lot, it's heavy from what we've been charged and the work that we've chosen to do. But again, thank you so much to the Sunday Supper Committee for having this much needed Youth Behavioral Health Forum as we are all witnessing and living in this global traumatic crisis together. We want to first advise, though, that this discussion about behavioral health, it can cause feelings that may arise that are uncomfortable, as myself and my colleagues may share stories and information. The conversations could be a trigger, and we want you to know that they can cause some type of an emotion, some anxiety, some panic as we move through today's discussion. We encourage you to take that moment if you need it during that time, if you need to stretch, breathe, and as Naryah had suggested, to definitely have some water handy for you. On behalf of my colleagues, we thank the participants also for joining us on this forum for this Sunday afternoon. As Naryah stated, you will be able to communicate with us through the chat function. And then as time hopefully will allow, you can bring your voice into this space with us. One thing to correct, as she noted, we were the experts. We are just folks who want to desire to be change agents. And I know, and I've seen names come in of many other experts that have joined us. So hopefully they will bring their names and their voices in this space also. We may call them out today. We also know there will be items that we will not be able to address today, as this topic of behavioral health is vast, and resources, as we may think, may not be plentiful on the Eastern Shore. But the one thing we do have on the Eastern Shore is a resource in people, close-knit communities, our neighbors, our law enforcement, our educators. We all know somebody that knows somebody in our communities. So we should be able to come together and pull together. First off, our why for today. Our why is because, as I stated, we all have been living in this global pandemic. And what studies from our federal, state, and local agencies are starting to show is the impact that COVID-19 is affecting our youth. And I do want to say hello to Dr. Patricia Salings, the superintendent for Queen Anne's County Public Schools, who has joined us. And hopefully you will also join in because I know some of the things that these studies have found that you've been able to see and witness within the school system. The studies are finding that our students who have ACEs, adverse childhood experiences, our students with disabilities, and our students that are have a COVID incident are at a greater risk of having a mental health diagnosis. Some of the top diagnoses that have increased during the pandemic are ADHD, anxiety, and depression. And so what we hope to do today is to introduce you to some resources that you may not have known existed. And if you do, we are able to put names and faces on those resources. As you've heard, the extent that my colleagues and their bios have, that they are versed and challenged with knowing where the resources are or being able to find those resources. But first, since you chose to join us this afternoon, we want to know your why for attending this session. And you can put this in the chat. We just want to know what brought you to this session today, and hopefully some of those items we can address. And if not, we will place them on our virtual parking lot and be able to look at them another time. And we can challenge the Sunday Supper Commission with having another series of behavioral health information. And so if you will, just put into the chat, why did you choose to attend today's session? I had the pleasure of attending a couple of the Sunday suppers, and probably before COVID kind of closed everything, it was an education Sunday supper at the Kennard. And that was very informative, but I was able to attend that one in person. It was a really great session. And I've been following this group. So congratulations to you all too for continuing this charge. So we see people, this is an interesting topic. Brandi, definitely here to share and the information and knowledge that you have. I'm going to be able to give friends and family information. I want to hear about student resilience from local change agents. And our students have definitely been resilient through this time. We want to know about SEL resources. Oh, they're rolling in now. Trying to catch them. So we have a classroom teacher, Ms. Adams Nichols. Okay. Hoping to gain perspective from outside the classroom and the impact of COVID, and always interested in tools and resources to use. And good afternoon, Bill and Barb Fluke. I see so many friends on here. I want to talk to everybody that are that's on this workshop this afternoon, but no, we don't have the time for that. See our commissioner here, Chris. Good afternoon to you too. Okay, thank you all so much for answering those questions. And what we want to do, and please keep those questions coming in, because as I stated, they can be used in our virtual parking lot to be able to have further conversation and further discussion, because today what we're giving is an overview of some of the resources that are in the community for you to be able to use. And there are many others that we could have brought to the table today, but definitely do not want to inundate the whole entire time with that. We want you to be able to take some of the resources that you will hear about today with you. And so Naryah, we do also, so this is interactive. So we're doing some talking today, and you're also working with us to guide this conversation as well. We do have a few questions to kind of just gauge where everyone is at with our behavioral resources in the community. And if you will pull up our first question, I don't know if you want to do it in the poll or how we want to do that.
I think we should probably just use the chat function because people are blowing that up and it looks fabulous. So the first question we have is, what 3 behavioral health resources are you aware of? So if you want to answer the question, what 3 behavioral health resources are you aware of, either in Queen Anne's County or kind of in the localized area, because we are a little bit spread out here. And again, if you are unfamiliar with how to access the chat function, usually at the bottom of your screen, there's a cute little bubble that says chat, and you can click on that and type directly into the box. The default is to everybody in the meeting. So if you have any problems with that, just give us a shout. All right, so we've got Bridges Behavioral Health, Chesapeake Bay Psychological, and Corsica. Drug and alcohol resources, school-employed mental health professionals, school-based mental health providers, and community-based providers. That's a good big umbrella there. We have counselors in the school, Striving for Wellness, which sounds like a program, Corsica River Mental Health, and For All Seasons. Character counts coaches, guidance counselors, social workers. I know there's lots of congregational-based mental health services. Midshore Domestic Violence, that's an excellent one. Thank you for that, Eric Goodman. Got Bridges in Centerville and counselors that come to school for grief counseling, SEL lessons through Second Steps. All right, this is a lot. I'm learning a lot here already.
Yes, and Naryah, and that is the purpose too of this exercise, is so we can see what the resources that we have in the community that we know of already. And then at the end, when we put together the resource list that will be emailed, we'll make sure that we have these listed, and then the other ones we will discuss today, and what other resources there are that we need to put together for the participants. So this is a great group of information coming in. And then if you will go to our question number 2, that would be great.
Behind door number 2 is, who are the Queen Anne's County QACPS mental health coordinators? So
and again, Dr. Salem cannot answer that question.
I cannot either. So again, that question is, who are the Queen Anne's County Public Schools mental health coordinators? Which I'm sure is going to be a lot easier if you have kids in the QACPS system, or if you work through it. We have a lot of people in the schools here, so shout out to our educators.
Yes, that's wonderful. Glad you all joined us today.
We have Chesapeake Children's Rich Winefield. Oh, we got a phone number in there too. Sarah Shelley is on this. Eboni says Sterling Ward.
Mhm.
Megan Pinder. Megan Pinder is a rock star. I know her personally. She's really cool. Megan Pinder, Nicole Connor, Leslie Fulham, Sterling Ward. Awesome.
Great. Thank you so much for answering that question. You said you agree with Mary. Yes, Megan. Also, one of our colleagues, Sterling, one of our colleagues in our resource world and being able to assist youth and families in the Mid-Shore area for quite some time.
All right, we ready to rock to number 3?
Yes, ma'am.
All right, our last question is, do you know how to refer a youth to services? The question again is, do you know how to refer a youth to services? Agreed, that's a no. That is same here.
We wanted to keep it that way, Bill or Barb Fluke. So it was meant to be broad.
We got with the help of a guidance counselor. That's excellent. And through the mental health coordinators. Eric brings up a good point. It says sometimes it's difficult if offices only offer virtual or phone contact. And that's definitely been a struggle that's been going on with the pandemic, limiting, in-person contact, especially, in many different ways with behavioral and mental health. And Coral says, no, but I know I can get answers from people at school, and that is an excellent resource. Yeah, and telecare does not work for everybody. So there are hotlines. Mary Walker's got a good one. There are a lot of really great hotlines. Eric Goodman says for juvenile services, you can do a CINS referral, which is children in need of supervision. Sharmita says social work, DSS, and the police. All right.
Okay, thank you all so much for answering those questions. And we are definitely going to address those questions that we answered, and we will circle back around to them at the end and make sure that we have information again in that resource document. So we are going to jump right in. We have this awesome panel of behavioral health professionals with us today. I'm going to ask Ms. Naryah Miles if she would be able to talk about, I'm going to bring up your presentation.
Thank
So
you.
Naryah, if you would please give some information, as we heard some of your bio, but you can talk about why you chose to go into social work, your why as well.
Absolutely.
And then I can assist you move through the slides, and you can just let me know when you need me to move through.
Absolutely. I can do all those things. I really appreciate that. And I appreciate the opportunity to even be able to briefly talk today, in the platform of this forum. So I am, like was communicated in my introduction, I'm the owner and the lead clinician here at the Wellness Center. I'm a new private practice on the Eastern Shore, but I'm serving all of Maryland through telehealth services. Why did I choose social work? Why am I in this field? Growing up in Queen Anne's County, there were just some times during, I think, my high school years, and I feel like I could have utilized a good therapist and really, someone there to just talk about kind of the growing pains. Sometimes we experience those, along the way on our journey. And there was really, no one. Not only did I not really know about the option of there being therapy within the Black community, we don't really talk about our feelings and emotions. We kind of just slide under the rug. You're going to be okay. We'll figure it out. And, a lot of times we tie in, religion to it as well. And as a motivator and a kind of source of hope and strength. But I acknowledge, through, my undergraduate experience and even, obtaining a master's degree that, there is someone, there's a therapist that, is able to guide you and give you support, when you do have challenging times and moments, on your journey. And so again, I wish that there was someone available when I needed support during that time of my life. And so I've done a lot of work after I graduated from Salisbury University in 2018 with my master's degree in Prince George's County and Baltimore City in the county as well. I've done therapy, I've done other programs, I worked in an alternative school. And so I just took all the knowledge that I gathered from those experiences and opportunities and just wanted to bring them back home. Queen Anne's County is my home. And so I want to bring everything that I learned back here. If we can go to the next slide, please. So this is just about us. It's just some of the core values that just not just myself, but the individuals on my team, just integrity, commitment, community collaboration, empowerment, unconditional positive regard. Those are some of the things that mean a lot to me and that I choose and have chosen to instill within the practice. I want any individual that we service in the community, we service with adults and children, just to feel empowered. We want them to feel just supported. We want them to feel like coming into right now, we do virtual telehealth, but we will also be obtaining some physical space because I think like someone mentioned, it's not always a good fit, telehealth as an option. Some people like that personable face-to-face experience. And I mean, we're really talking about the most vulnerable points in our life. And so it's completely understandable. And we'll be opening an office space, hopefully cross our fingers in the next 2 to 3 weeks. So we will have that opportunity or we'll have that option for just clients and their families. So again, we hope to and we strive to give our clients quality services that they need and deserve, and just to provide a safe space for people to kind of unload and pack and learn how to deal with things that they're experiencing. You can go to the next slide. This is Latasha Harmon. She is just one of the newest members of our team, and she is also a graduate of Salisbury University. She'll be working mostly with children and families. She currently, does work in and has some clients in the school-based setting. And so I just wanted to just highlight and showcase her because, if our organization is a good fit, then she will be working, with some of the children and families that are in need. We can go to the next slide. This is what we offer. We offer individual counseling, group counseling, family sessions. One thing that I think we offer that kind of sets us apart is our holistic consultations. So I'm still a student, but I'm under Dr. Jen Bentley. She is a naturopathic, doctor, and she is based out of Washington, D.C. So I'm learning and observing her. And right now we're going over how to just observe and assess organs and give different just vitamin recommendations to clients. And then also because we are aware that how every different realm of health does truly impact our overall wellness. So I just really think that it's important to kind of think about what foods we put in our body, what is our sleep regimen, all of those different aspects I really wanted to integrate into every client's treatment at the wellness center. So we do look at all of those things. And we also will have, when we do have the in-person office space, we will have options for clients and their families, just different organic and natural options as far as vitamins and minerals to implement into their diets if they choose to do so. And if they, of course, you would have to follow through with your doctor to make sure it's okay. The next slide, please. This is more geared to our youth, of course, but these are some of the groups that we will be providing. And eventually they will be weekly. Right now they are bi-weekly groups. And some of the topics that we will be discussing: anxiety, trauma, anger, grief. And we haven't started the skills-based groups, but they're at the bottom. We'll be doing some groups that are just structured on coping skills and then social skills as well. And then we'll be using, of course, evidence-based curriculums for those things. We can go to the next slide. So I already spoke to this a little bit, but just the holistic component. And outsourcing. There are some other holistic consultants that live on the Western Shore. And so, if it's something that I was not able to assist with, I could reach out to colleagues who are still in the field and could get clients just the support that they need, as far as if they needed a diet regimen, or they really needed an in-depth sleep schedule, or just something to implement, whether it was like melatonin or just their other natural vitamins that aid in sleep. So there, there are some of my colleagues who could also assist with giving some guidance and direction in that capacity. One of the natural alternatives that we currently do offer for clients is CMOS, and I'm not sure how many people are familiar, but for our clients, we have pamphlets and brochures that really detail, what CMOS can do, for our bodies, how it stimulates, your thyroid, and how it really can help with energy, and it can, alleviate fatigue. And again, with the Wellness Center, we are looking at all of the realms of health, even though that we are focusing on mental health, we wanted to add some other components too, because again, they all align, and they all coexist with one another to give us just the opportunity to live the best quality of life that we can. And just the last slide is just how to contact us. Our fax number is the first number. The middle number is just our office number. And then the last is their email. Just any questions, concerns. And we could also, if anyone is interested or think that our practice will be a good fit for someone, we do have a referral form that can also be sent out. But yeah, I'm very happy to be a new provider, in Queen Anne's County. Again, it's my home, and I look forward to doing some really good work in the community with, youth and our families. And that's all that I have. Again, I appreciate the opportunity to briefly speak, but that's all I have.
Thank you so much, Naryah, for that information and for giving us an updates on where you're going and what your goals are for your practice. Thought it is definitely important as a Queen Anne's County native to be able to come back and share information that you've went out and learned, and now being able to come back and to work with some of the students in Queen Anne's County. Do we have any questions for Naryah? She will need to leave us early.
Yes.
And I do see just a comment of many thank yous, Naryah.
No problem. No problem at all.
For your information, but thank you so much. And if you could leave us with one self-care tip, what would that be?
Sure. Outside when the weather permits. Oh my gosh, like sun is amazing. To having the sun and that vitamin D in our bodies. I feel like that is something that's free, something we can all do, again, weather permitting. And if not, even just something as simple as a shower, just really cutting everything out and just taking a shower and just exhaling, and just really decompressing from the day. And as the water falls, just allowing everything that happened and transpired, during the day kind of wash away. So
Thank you so much for that. And many comments and about the
absolutely.
holistic approach and being able for
Okay.
people to really learn more about that, which we know is so important when we are looking at the
Yeah.
whole self. We do have one question. What actions have you
Okay.
or other mental health providers brought forth as a result of the recent middle school suicide? And what I'm going to do with that question, if that is one, Naryah, if you will say for us, please, if we will make note to come back to that. Okay.
I have one question for Naryah.
Go ahead,
Sure.
Mr. Bishop.
This is Doug Bishop from the Bay Times newspaper. Naryah, I have taken your picture many times.
I know. How are you?
In your youth, I mean, not that you're elderly or anything, but when they introduced you, I was expecting you to sing. Because I know you're a great singer, and I just wanted to comment on that quickly. That's all. Thank you.
Thank you.
Thank you so much.
Good to
Thank
see
you.
you.
All right, thank you, Naryah. And Commissioner is asking, how can we attract more professionals? And not specifically for you to definitely have to answer. And if you have thoughts though, about how can we attract more professionals
Mhm,
like you to open a
mhm.
practice in the county?
I know for me it was personal because I'm born and raised here. I think doing more outreach, even at Salisbury University, just knowing that there is a need here, versus people who do come to Salisbury University or even UMES, just acknowledging that there is need here. So I guess again doing just more outreach, for new graduates, or even I know there's a lot of job fairs and career fairs that happen to take place at Salisbury University, and then UMES as well. So that's just a suggestion, and a thought that I have as far as retaining people versus having them go back to the Western Shore.
Perfect. Thank you so much. Definitely
No
appreciate
problem.
that. Okay, well, thank you so much, Naryah. We greatly appreciate your time this Sunday afternoon for sharing with
Not
us
a
about the
problem.
Wellness Center. All
Not a
right.
problem.
Okay, so I'm going to change PowerPoints here.
While you do that, I'm just going to remind everybody that if you do have any questions that are popping up during these presentations, please use the chat feature, because we're definitely going to, use that to provide the commentary and the questions that we're getting. Like Gina just said, she loves how she integrated the whole person into the treatment with nutrition, exercise, time outside. It's all very important, which is, it's a great thing to add into that. It is something I don't think we look at enough when it comes to mental and behavioral health.
Okay, we will see now. We have our next presentation. And so our next presentation will be from Eboni Taylor-Tue. And as you heard from her bio, she is a licensed clinical social worker. And Eboni is the site coordinator for the Kent County Office of Eastern Shore Psychological Services. She is wearing dual hats for us this afternoon. So we thank her for doing this. I'm going to probably have to treat her to a nice lunch or something by the time we're done. And so she also, as a board member for Midshore Behavioral Health, she's going to review their information, as Midshore Behavioral Health is our core service agency here on the Eastern Shore for the Midshore counties. And she will let us know what core service organizations do. They are the convener for services and supports, our homelessness, our substance use. They're charged with monitoring our behavioral health resources, and just another great resource where you can get someone on the phone. They have, their workers are now in the office and some are virtual, but a good starting point to be able to find resources and how to make those referral, as that was one of our questions. How do you refer a youth? This is a great starting point for that. So Eboni, I am going to turn it over to you. I guess we will first start with our umbrella organization with talking about Midshore Behavioral Health. And as you need me to go through the slides, the ones that you feel for today's discussion, we can pull those up and we can move through the other ones.
Okay, great. So good afternoon, everyone. Thank you so much for having me. But before we begin, I would be remiss if I didn't talk about Eastern Shore Psychological Services, because that is my primary job. I am a therapist at Eastern ESPS for short, and I'm located in the Chestertown office. And we provide mental health and substance use services to adolescent and adult clients there. We also are doing medication management, and we also have PRP, which is psychiatric rehabilitation program, in which a client is assigned a family advocate and they work with the entire family. We are also doing school-based services. Right now, we are only in Kent County. Before COVID, we were working with Sterling to start to get into Queen Anne's County schools, but then COVID happened. And I personally reached out to Queen Anne's County High School to see if I could come in a couple of days, and I haven't heard anything back. So I don't know who I need to connect with, but I will be willing to do that, because I know there are a lot of issues in Queen Anne's County schools. So I can leave my information, or someone can give me the contact, because I think it's very much needed. So that's what we do at ESPS. But today I'm going to talk about Midshore Behavioral Health. I'm a board member on Midshore Behavioral Health. I've been a board member for about 3 years now. So you go to the next slide, Doncella, please. Okay, there we go. So Midshore Behavioral Health is the private not-for-profit core service agency that serves the five counties on the Midshore. So we serve Caroline, Dorchester, Kent, Queen Anne's, and Talbot counties. Midshore Behavioral Health is the only regional CSA in the state. And basically it is responsible for community planning, system management, and monitoring of the funded behavioral health services in the five counties of the regions. So they monitor the children's services, the adolescent services, and the adults and aging population. Any resource that is available in those five counties, Midshore Behavioral Health has the information. So I know that Doncella, they had the resource guide. Every resource in those five counties is listed in the resource guide. So I guess we can provide that information a little bit later, but you will have that information. Next slide, please. Can you hear me? Oh, okay. So this is just the mission and the vision of Midshore Behavioral Health. The mission to improve the provision of behavioral health services for the residents in those counties that I told you about, through effective coordination and collaboration with consumers, their natural support system and providers, and the community at large. And then our vision is a rural behavioral healthcare delivery system that is clinically and culturally competent. This will ensure access to have the community focus, be cost effective, and integrated to serve the community as a whole. Next slide. So this is just a map of the area that the Midshore services, and from Kent County, Queen Anne's, just that middle part, the Midshore. We don't do Cecil and we don't do the Lower Shore. All right. You can skip this slide. Okay, so these are some of the work groups and coalitions that fall under the Midshore umbrella. They have the Behavioral Health Services Network. They do a roundtable on homelessness. There's a Forensic and Crisis Services work group. They have adult services, children and adolescent and young adult work group, the Eastern Shore Local Systems Management Integration work group. They have the Behavioral Health Coalition, the Safe Station. There's a Safe Station in Caroline County, the Recovering Housing, and their Diversity and Inclusion work group. Next slide, please.
Hold on. I don't know, my button doesn't like to move these slides. There we go.
Okay, next slide, programs and services. Okay, so the Eastern Shore Crisis Response services, which I also work for part-time, and Brandy's going to give more, so I won't give too much information about that because Brandy's going to talk about that. But the Eastern Shore Crisis Response is a 24/7, 365 hotline that you can call, and the hotline number is right there highlighted. And whatever the crisis is for the individual, it does not matter, you know, whatever they feel the crisis is, they can call this hotline. And this Eastern Shore Crisis Response actually services the 9 counties on the Eastern Shore. So they go Somerset, Worcester, Wacomico, Dorchester, Talbot, Caroline, Queen Anne's, Kent, and Cecil. So what happens is you would call that hotline number, and we have mobile crisis teams throughout the those counties, and we would send someone out, and we can meet the client wherever they are. We do not provide transportation though, so let me just say that we don't provide transportation, but we'll meet with the client, we assess them, we give them resources. We also have urgent care appointments with local providers in those counties, so we can set them up with a therapy appointment, because there is a waiting list for a lot of places. But if they contact mobile crisis and ask for an urgent care appointment, they are seen within the next day or 2 days. It's usually not a long wait. And so that's our urgent care services. And then once they're linked, mobile crisis pulls out. So it's just a short term linking them, making sure the client is stable, and then we pull out. But they can always call back. There's no limit. They can always call back. But I'll let Brandy touch more on that when she does her part. Next slide. I'm sorry, I was reading the chat. Next slide.
Hold on, like I said, I don't.
Okay.
There we go.
Okay. So this is the urgent care services. Like I said, if you call the mobile crisis hotline, you can ask for an urgent care appointment, And what happens is they're all in 9 counties. So like For All Seasons is one, Lower Shore Clinic, Corsica River, Kent Behavioral Health. They have these spots available for just this population. And you're guaranteed an appointment within 24 to 48 hours. And then they'll do an assessment, do an intake, and then they'll follow up with you, and they'll try to get you, if you need medication, to see a psychiatrist. Usually that's within 30 days. So this is a great resource for people who need services immediately. We meaning mobile crisis. If you call us and something's happening in the school, we will come to the school and assess the student and figure out what we can do. It's crisis management. So that's what we're there for. So please utilize the services. We have no problem coming out 24/7, 365. You can skip all this continuum of care stuff. Thank you, Audra, for doing this, but we don't need all this. The crisis bed is more for adults, so I don't know if I need to go over this, Doncella, because they don't have adolescent crisis beds. I don't think. Yeah.
No, and that's one thing to note too, when we don't have the resources. So that is also, and definitely a need for this area, is to be able to have those crisis beds available for our youth. So we will move through that. Did you want to you touched on the safe stations? Did you want to talk about?
Oh yeah, so the safe station, there are 3 currently that affiliated Sante is working with: Wacomico, Worcester, and Caroline County. So the safe stations are just for people that are struggling with substance use issues. They can go to the safe station and get services, get some resources, try to get linked into inpatient treatment. So those are available, and it's really a deterrent, so that like some people are afraid to come because they may have warrants or things like that because of where they're located. Also, like the Caroline County one is in the sheriff's department, but we're trying to let people know that, you know, still come get the services that you need. Don't worry about that. But this is just the opportunity for people who are struggling with not only opiates, but any substance use that they may be having. And this is for adults and adolescents as well. It's not just for adults.
Skip that.
You can skip that, yeah. I guess I can talk. Yeah. So the forensic mental health program, this is through Midshore, and this works with clients who are in a detention center or probation. Now, I don't think it's DJS, and that's more to what we're geared to, but this helps this program helps clients get intensive case management. So if they're in the forensic population, it helps them to figure out ways to not reoffend, to figure out what resources they can have to help them to stay in the community. And it works with their probation officers. If they might have drug court, it works with drug court in different counties. And they have a problem solving court. So they have a case manager at Midshore that works with like a therapist. You have a whole team. So you have a therapist, your drug court counselor, and you're working in the community to help this person not reoffend, but to get the services that they also need. They do have to have a mental health diagnosis though for this. And I don't think they work with DJS. I think this is just for adults, but I just wanted to share that with you. You can skip that one. Okay. Family and youth services. So they have youth respite services. I don't know if you are familiar with that. And these services are for the provider, not for the youth, but for the provider to get a break. So you can contact Midshore and find out what their youth respite services are, and they will send that youth to a family who is trained and available to provide a respite for the caregiver so that they can have a little break. So I don't know if people were aware of that as well. And then they have transitional age youth assistant clients that are in the residential program. So this is the TAY housing, and these are for adolescents and young adults who have mental health diagnosis, who are not able to remain at home with their family. They may be eligible to live in a TAY house, and you can contact Midshore to find out how to go about making that referral. It has to come from a therapist, so they have to be in therapy. The therapist completes the referral, and then they try to place these youth in houses with other youth to help them transition. Caroline County school-based program. Let's see, the Adolescent Clubhouse. Doncella, do you want to talk? Want me to save that for you?
Yes, we will talk about that.
Okay. And I think that's it for that one. You can slip to the next slide.
Yeah, I don't know what the magic click number is to move it, but we will see. Okay.
You can skip this one as well.
All right.
You can skip this one. You can skip that. That's for there.
Okay.
All right.
All right. So I want to thank Eboni. We had a one of the child and adolescent coordinators that was due to provide information from Midshore and was not able to attend today. So Eboni agreed to step in to be able to present the information about Midshore as a board member. And then also, as you heard her give, that she also works part-time for Mobile Crisis. And then she is full-time at Eastern Shore Psychological Services. So she is well-versed in the resources that we have here on the Midshore. So Eboni, thank you so much. And I was trying to look at the chat as well, because I see the chat function. We want to be able to talk and see Eboni. Just thanking you for the information coming in. And we have someone talking about wanting the safe station in Queen Anne's County. I do believe we have the Sheriff's Office also with us today. All right, well, thank you so much. And any questions for Eboni? And Eboni, just going to ask you, as we asked Naryah, what's a self-care tip that you would leave our participants?
So for me, I guess the tip I would do is that I give to a lot of my adolescents. Like I said, I'm in Kent County High School and working. I see right now I'm seeing a lot of anxiety, a lot of depression, even some trauma, and we're doing a lot of journaling. And journaling is really working for this population. And what I think when at first I'm like, Miss Eboni, I don't want to write. And I'm like, no, listen, you just get a notebook, you can scribble upside down, you can, it does not have to be neat. I do not have to read it. And it's just for them to get their thoughts out of their head and onto paper. And they are really enjoying that because they think, I guess they thought it was like a school assignment, like it had to be neat and paragraph form. And I'm like, no. You can write in crayon, you can do whatever. So we've been doing that. And also just taking some time to just meditate and breathe. Like just be present in the space right now. Like don't think about anything else. Just take some time just to breathe and just meditate. So that's what we've been doing out to Kent County High School.
Thank you so much. And we did have a question, which you have been answering that about what do you think are the most alarming indicators and stats that illustrate the adverse effect of the pandemic that's having on our children's mental health, in which you began to talk about the anxiety and different things that you're seeing there.
Yes, anxiety, depression, definitely acting out, not knowing how to communicate how they're feeling, not knowing who they can talk to. I hate to say this, but they're seeing adults misbehave. So they're like, okay, we can't even go to these adults. So who can we talk to? Unfortunately. So that's the biggest thing, like not knowing who they can talk to, not knowing how to even communicate how they're feeling. So those are the biggest things.
Okay. Thank you so much.
Hey, Eric.
Saying a fellow Washington College grad. And thank you for that information. And journaling is definitely, as someone, Ms. Carol Franks Randall, thank you, stating that journaling is so powerful and just reminding us to do that. And I like that you said too, you can do it in crayon. That it doesn't have to be the specific gel pens and neat little pens, that you can do the journaling there in crayon for us. But thank you so much, Eboni, for that information.
Thank you.
And
We have another question for Eboni, if I
go
can
right ahead. Go ahead.
Eboni, can you elaborate on the function of a safe station, please?
So Where is Brandy? She can probably do that.
Yeah, we can. We can
Okay.
put that to Brandy, Ebony,
Yeah,
if you want.
yeah.
Yeah, because that's part of her. And she's up next, so we can give that to Brandy.
We got another one that says, do you utilize advocates who are not mental health professionals but care about others, especially the young?
Absolutely. You have to. So I'm also a mentor. I founded Operation Glow Girls Learning Our Worth, and I work with 7 amazing women who are not professionals. I have someone who's a pastor. I have someone who does hair in the local community. So we have to meet these kids where they are. So coaches, even like people that like Big Mix, I don't know if you are familiar, but like a local barber. So yes, you have to, it's not all about, I mean, just me as a mental health professional, but what do they enjoy? Who can they connect with? So yes, that for me, it definitely takes a village. It's not just because I have some letters behind my name, I know everything. That is not true. So yes.
And Dr. Salins would like your contact information, and we can make sure to get that to her.
Okay.
To have you join in Queen Anne's County Public Schools and
Yes,
assist our students there. Okay. And I think, Naryah, did we miss any questions there?
I think we're good. I think we got them.
Okay.
Thank you.
Sounds
Thank
good.
you so much, Ebony.
Good.
I am excited to look at that PowerPoint in detail because that was incredible.
Yes. And Ebony did a great job stepping in. Like I said, I'm going to have to treat her to lunch for doing that for us today. And so we are at the top of the hour at 3 o'clock. And so didn't know if we needed a stretch break, if we needed to get a cup of water, a sip of water. And as we do that, and we can get Brandy ready to go. And just wanted to have Brandy, the question was about the safe stations and how to access the safe stations for you. And Brandy will also discuss crisis intervention training and more in detail of mobile crisis services.
I think we can probably power on through. We're usually pretty good about sitting for the 2-hour stretch.
For the hours. Wonderful, wonderful. All right, so Miss Brandy, I am going to turn it over to you. And as we just ran down Brandy James' resume, that she is a CIT. And a lot of us speak in acronyms. So being real intentional today to make sure we explain out these acronyms to everyone. And if we do mention an acronym and we don't remember to go back and explain it, please, please, please put in the chat or come off of mute and ask us to elaborate on that. And so Brandy, I'm going to turn it over to you.
Hi, everyone. So as Doncella said, I'm Brandy James, and I work with Eastern Shore Crisis Response Services, who is under the umbrella of Affiliated Sante Group. And I'm the Crisis Intervention Team. That's what CIT stands for, Coordinator Manager. So about our program, Ebony did go over a lot of it. Thank you, Ebony. You make what I have to say a whole lot easier. We have a lot of different programs within our agency. As Ebony stated, we have the mobile crisis team, and those teams, well, I guess I should start off with, we've been a crisis provider on the Eastern Shore since 2009. We have 4 mobile crisis teams. We have a team in Salisbury, which serves the Wicomico Somerset area. We have a team in Talbot County, which serves Dorchester, Talbot, and we have a team in Queen Anne's County, which serves Queen Anne's County and Kent County. And we have a team in the Cecil County region, which serves Cecil County. We don't have any team that serves Worcester County. Worcester County has their own mobile crisis team there. And our team consists of social workers, professional counselors. We have substance use professionals. We have peers. And peer support specialists, and we have some master level interns. We serve a 2-team model, which means usually when the team comes out, there's usually 2 people to a team. So we usually have 1 person that serves on the overnight shift because we are 24/7, 365. We do respond with police when called out with police as well. Our services are funded by state grants through the Midshore Behavioral Health Service, which is the core service agency that Ebony just spoke of. And our services is of no cost to consumers. Our services are voluntary, which means the individual has to want services. We can't force services on the individual. And we are a CARF accredited program. So some of our goals is to reduce the emergency room visits for behavioral health, increasing ED alternatives to outpatient treatment resources, resolve crisis in the most natural and supportive way for clients, and support clients in the least restrictive settings. We want to work towards resolution with frequent 911 callers. We try to encourage individuals that are constantly calling 911 in non-emergency situations to rely on the 888 number. And in case you didn't get it off of the slide that Eboni had, the 888 number is 888-407-8018, and that's a 24/7 hotline. It's staffed 24/7. You know, anyone can call. It's not just professionals. Community members can call, police can call, anyone can call that number to access the team or to access services. If you don't, sometimes if you just want to speak to someone, talk to someone, you can talk to a phone counselor. They're there to talk to you. As Eboni stated before, we let the consumer define what their crisis is. So like I usually tell officers that I train, you know, if you broke your nail and you're in crisis because of it, you can call us and we'll help you through that. So no matter how small the crisis is, we can help you process and get through that crisis. We can help link you to services if possible. We have the urgent care appointments that Eboni spoke about earlier. And, you know, we serve an array of people throughout the counties that we serve in, and we do get calls sometimes from different counties in different states. And if it's something that's outside of the counties that we serve, the people who answers the telephone, they can refer you to a crisis service in the county that you're in. So if someone from PG County calls our number by accident, we just don't throw them to the wayside and said you called the wrong number. We actually connect them to PG County crisis to make sure they're getting a warm handoff to help. So another program that we do have the Youth and Adolescents program with mobile crisis, and they do serve Dorchester, Talbot, and Queen Anne's County. I apologize in advance because I don't have a lot of information on the Youth and Adolescents program. I do know they take a lot of referrals from the school, and they provide services and supports to youth who may have some sort of crisis going on. But I could get more information and share with Doncella to send out to the group, but I don't have it with me today, and I apologize for that. So more so to what I do. So we have the crisis intervention team. And what that is it's a training for law enforcement and individuals who work under the criminal justice umbrella, corrections, probation and parole, DJS. We provide trainings to them on, it's basically de-escalation training. We train them how to go into a situation with the individual who may be in, and how to, you know, instead of going in hands-on, let's look at the bigger picture. Is there something else going on here? You know, is there another way to resolve this if necessary? We're not telling them not to arrest someone, but we're trying to tell them to divert that person or that individual from jail or the criminal justice system in situations that they can be diverted. They get trained on a various array of things. It's a week-long training, so they're there every day for a whole entire work week. And they get mental health first aid trained. They're trained in youth. They're trained in geriatrics. So they're trained on a wide array of things in that CIT training. And then they have to do practicals to display that they have grasped the concept and can perform as they were trained to perform. So they do have to go through practicals and they have to test out of the training. We have been doing that. I've been doing that training for 7 years. When I started doing this in the entire Eastern Shore, there were 7 officers trained, and now we're over 200 officers trained throughout the Eastern Shore. So every county does have CIT trained officers. Another thing that we teach officers, that we train officers about, is self-care and self-wellness. We want them to be in good shape. We want them to, you know, recognize their triggers, their stress levels, so that they can be a benefit to the community that they serve. We also do critical stress incident management, and that's the agency as a whole, but we have taken this to training law enforcement officers in this too. So when a critical incident happens, we can deploy a group of individuals who are trained to go to that incident, that critical incident, and do diffusions or do debriefings to, you know, give resources and to let the individuals affected know what's normal, what's not normal, what to expect, and what are some resources they can reach out to after being in that traumatic or critical incident. So we have worked in Queen Anne's County on a numerous amount of cases with that. I'm doing that, and we do it throughout the Eastern Shore. So if something critical happened, I know they had spoke about a suicide, you know, that's something you can call the 888 number and say, hey, we want to do a critical stress management debriefing, and we'll get the team up to wherever that place is, whether it be the school or church or wherever. We come to you wherever you are. That's the same if it's just an individual situation that's in crisis. If you want us to meet you at Burger King, we'll meet you at Burger King. It's wherever you feel comfortable at. We meet you where you are. So those are some of the things that we do, and those are that's what I do for my job. I do smaller trainings as well with law enforcement, and I do smaller trainings with the community as well. Something else that fell underneath for the CIT umbrella was the safe stations. Queen Anne's County, someone said they wanted one in Queen Anne's County. There was one in Queen Anne's County, but it shut down, I believe, because it was not being utilized. You know, the safe station that's in Caroline County, Sheriff Bounds wanted one, and we work collaboratively together to get that up and going. And it's been going, and, you know, it's being utilized, and, you know, you have to have a lot of parties involved in the safe station. So the idea of a safe station is that, you know, we're in a rural area, and if someone is at 2 o'clock in the morning saying, hey, I want help, there's nowhere open, there's nowhere for that person to go. So safe stations are places that a person can report to and say, hey, I need to get help. And it's designated to be safe because when police are there, or if police comes, if they have substances on them, they're not to be arrested. They're not to be charged for what they may have on them. They are to be referred to help. So that's why it's called safe. So that's how it is in Sheriff Bounds' office. As soon as you go there and say you want help, they fill out a form, they get you in contact with a peer that's on the mobile crisis team, and that peer works with that individual to get them into treatment or work with them however it is they may be that person needs to be worked with. That's something that they set up. I mean, it's very elaborate. They actually have snacks there. So like if the person is waiting for the team to get there, they can have some chips and a drink of water, or, you know, there's different things available for them. Or if it's a COVID situation or whatever, there's a iPad there where they could do telehealth with the peer. So there's different options that they can do. The state's attorney, Joe Rowley, he's still involved in this, and he's heavily, you know, making sure that, you know, safe stations are implemented within the courts as well. We were just currently talking about safe stations, utilizing a safe station model with juveniles. Anne Arundel County has a juvenile safe station model that's within schools, and it's called the STAR program. So we've been talking about trying to add that on some kind of way, maybe in Caroline County. How can we make this available for youth as well? There is one in Talbot County as well. Theirs is located in the DES building, and we work with them too in their safe stations as well. So I think that's the gist of everything that I have for mobile crisis. Is there any questions for me?
Brand
in here.
Go ahead, Mariella.
Sorry. We had one that was an ask for the explanation of crisis beds and how we're affected by a lack of them in our area.
I think that may be an Eboni question.
Okay.
Than a Brandy question about the crisis beds.
Yeah.
So right now our crisis beds are at the Whitsitt Center, and they're unfortunately only for adults. We do not have crisis beds for youth. And I don't even know how we would even go about getting those beds, because that's not a youth facility. It's only an adult facility. But we do not have crisis beds for youth, not that I'm aware of, and somebody else might know, but not in the area. I don't think we have any crisis. The closest thing to crisis bed would be the respite service, where you could contact and have you know, the youth placed with a respite provider. But I don't know how soon or how long. I mean, it's not really, you know, quick, but that's the only thing that I guess would come close to like a crisis bed for youth.
All right, thank you. I mean, and the second part of that was from Miss Mary about what is the result of us not having those crisis beds. And for me, it's because our youth have to go out of state. They have to go to Delaware, they have to go to Baltimore. And so our families, we already know our barriers on the shore is transportation. It could be funding to be able to want to attend therapy visits and to have the youth transition back into the community successfully. One of the places that looks at our youth that may need to have an inpatient stay at some of these facilities, our Rockford Center, Sun Behavioral Health, Shepherd Pratt, that our local management board is the place for that, for you to be able to receive those services. Our local care teams, every county has a local care team, and it is the one organization, also like Mission Behavioral Health, that is that convener to bring together everyone that is working with that youth. So you have your state agency leads that are there, you have the family that also attends this meeting to develop a plan for those students.
And Doncella, can I add one thing?
Yes, ma'am.
Queen Anne's County. I just wanted to say that we also are currently working with Queen Anne's County Sheriff's Office, Captain Amoya, First Sergeant Van Sant, Major Boardman. We've all working together. They are working to do some sort of a model with the police and the clinician. So when they have like barricade situations or situations that, you know, someone is in crisis and there's a lot of police on hand, that they can have access to clinicians, as well as working with them on situations with the Bay Bridge. So we are we are working with them, and they are coming into this century with, we need to do things a little bit different. We need to try to find different ways to handle these situations. So I just wanted to give them kudos, because they are, taking the reins and trying to make this work with limited funding, limited staffing. They are, doing the best they can to get this thing going with them. And I can tell you a couple of situations that they have relied on the clinicians from Mobile Crisis to come out and assist them with. So I just wanted to put that out there. And, and also they're working to get their school resource officers trained in crisis intervention team training, because they realize that it is needed with working in the schools with kids. So kudos to that agency.
Thank you so much, Brandy, for all your information. And I did just want to go back to the question that was asked about the 16-year-old, and that you had mentioned what can be done, and just wanted to share what you did for us. In Caroline County, we had the incident of a young man that was fatally killed by another community member. And so Brittany, give me a whole new name. Brandy and her team was able to come into the county and set up in a local church. And so community members were able to go down and meet with Brandy and her team members to be able to talk through the incident and receive referrals for resources that they may need ongoing. So those are the types of things that can be done in the counties when we have those tragic incidents that occur with our youth and our students. So that is something that we could be able to do, Brandy, that if they wanted to reach out to you to be able to form. Give me the official name of that.
We call it, the acronym is called CISM. It's CIS, yes, but it stands for Critical Incident Stress Management.
Thank you. And that was a CISM, Critical Incident Stress Management.
And there's different types of them that you can do depending on the situation and how close it is to the timing that the situation had. But those who are trained to do it, they know what is needed when it's called on. So, 24/7, if something happens, I know firefighters use it all the time when they have like really bad accidents on the road, or their, EMS uses it, police uses it. So it's a good resource, and it's a good way to get it in people's mind that, hey, I'm going to experience this at some point in time, and when it gets unnormal for them. And we've done it in Dorchester County with a suicide pact. We had to go in and do this with the school and all this. So, I mean, it works, and it's a really, really good resource that our agency offers. I would say utilize the resource while it's here.
Yes. Thank you so much for that. We had a question about how a person can volunteer to help with transportation for families or youth to get the services. And another kudos, though, to Queen Anne's County. The Queen Anne's County Local Management Board has transportation funding, and I'll let when we move to our presentation, Yolanda, we can discuss what we learned about the transportation, because I didn't know that resource was available in Queen Anne's County, but we did learn about that also.
Can I just say something to add to that, Doncella?
Yes.
As far as mobile crisis, because we, like I said, we do not transport, we are not able to transport. But if a volunteer is, as long as the person does not need a EP, an emergency petition, and they're not going to hurt themselves or someone else, a volunteer can transport, to a shelter or to the hospital or to a friend's house. So yes, we do utilize volunteers, but if that person is unsafe, then we have to call the police to have them, to have the police do the escort.
All right, thank you so much. And a local care team is different from a safe station. The safe station, we have our community members that actually show up to where they're located in Caroline County. It's at the sheriff's office, and they're able to get them to the resource from the safe station. The local care team is a team that the local management boards facilitate. You have a local care team coordinator in each of the LMBs. And what they do, if a referral is made, a family can make a referral, or the school can make a referral, a mental health therapist can make the referral for the family to be seen or be heard at the local care team. And you come up with a plan for all organizations. So you have Juvenile Services, Social Services there, Maryland Coalition of Families, Wraparound Maryland, all those supports are at the table to be able to come up with a plan for their students. And the goal of the local care team is to maintain our youth safely in our community. If it goes further than that, such as a volunteer placement agreement, that is moved to the Department of Social Services, in which they would handle that from that point on. And there is a local care team in Queen Anne's County. And I was the local care team coordinator for Kent County's local management board. And so there are local care teams in all of our midshore counties. And Yolanda put in the chat, the transportation and voucher program coordinator is Lisa Michaels. Okay, thank you all so much for that, Brandy. And Brandy's given information to be able to speak to the Queen Anne's County LDAC. And Brandy, do you want to explain the LDAC? You put an acronym in there, so you don't have to explain what that acronym is.
Sorry, if you all go, you've probably seen my face in just about all of them. So it's the local drug alcohol abuse council. Each county has one, and Queen Anne's County has one. I want to say they meet the second Thursday of the month, and it is at 7:30 in the morning. They spearheaded the last initiative in Queen Anne's County for the safe station that was there. And it was just not being used. It wasn't being utilized. So I would say if the county or citizens in Queen Anne's County is interested in having a safe station there, I would start back with the local LDAC committee, because they worked with the health department to get that set up and to have it all, organized and whatnot, to show interest that the community does want a safe station.
All right, thank you so much, Brandy.
And Mary, if you give me a minute, I will get you a contact for the LDAC.
All right, thank you.
I think all of that's going to go out with the resource list that we'll be sending out eventually. It's going to have, because we have so many things we've been going over tonight, that we're going to be able to, get that out to everybody.
Thank you, Brandy, again, for all that useful information. As she stated, use the resources so we don't lose them, because that is exactly what will happen as she discussed the safe station. Definitely interested in the youth safe station, and we'll be watching for that. And so our final presentation will be myself and Yolanda Acree. We will discuss the program Naryah's Dream Alliance, which is the nonprofit that I co-founded with Paul Tue, to be able to provide and continue supports and services in the Midshore area. So we will discuss an overview of Naryah's Dream Alliance, but also our two programs that youth in Queen Anne's County specifically can benefit from. And just to talk quickly about some of our other programs, we do offer a Senior Feed the Elderly program. This program was started mid-pandemic. It has now, with the pandemic, it's unreal that we're going into the third year, but we are. And so this program started at the beginning of the pandemic to assist seniors that are homebound. And so they receive a weekly delivery of fresh produce, protein, shelf staple items, and that goes out to over 200 homebound seniors. Next week, we will start having students come and volunteer in our program. This is located in Kent County. And then also just some other initiatives that we've been able to do: backpack drives, law enforcement lunch day, and then also continuing through with our Feed the Elderly program, our Thanksgiving drive there. Going to have Yolanda Acree. Yolanda is our program coordinator for our Community Mentoring Program, which is specific for Queen Anne's County students. So I'm going to let Yolanda go ahead and talk through that for us.
Hello, everyone. So as Doncella said, I am the coordinator for this program. It has existed in Queen Anne's County for over a decade now. It was managed by the local management board. But in 2021, My Naryah's Dream Alliance took over the administration of the program. So we are just now getting started and up and running. We're actually going to beginning program this week. So it's specifically for Queen Anne's County youth, at-risk youth in grades 7 through 12. And then disconnected youth ages 16 to 24 who are not in school and not working. So when we talk about youth that are at risk of disconnection and youth are disconnected, we're talking about those who may be having difficulties dealing with transitions in their life. They may have mental health concerns. They may be having issues at school with attendance or keeping up with their workload or behavioral issues. Some of our youth are also impacted by incarceration of their relatives. And other issues like that. The goal of our program is to either strengthen those connections for the youth that are at risk, or reestablish those connections for the youth who are not in school and not working. Our referrals have been overwhelmingly male. I guess that's a question that I want to pose to the group to think about. Is one, how do we get more male mentors, but also how do we attract more male, I guess, service providers? A lot of the people that I talk to and get referrals from are females. And there's no, there's not saying that females cannot connect with males, but I feel that they respond better to someone of the same gender, someone that relates to them and looks like them. So we definitely need to attract more males to the mental health professions and to do more direct service with our youth. Part of the program, what we want to offer to them is one, just a safe space where they can be, where the attention is solely focused on them and they're not required to do anything as they are in school, or if they have to meet other obligations for programs that they're in. We want to offer life skills to them. In addition to one-on-one mentoring, there will be opportunities for group mentoring with some of our workshops and programs. We want to provide them with some behavioral health awareness for them to help manage some of the things that they're experiencing. We also want to provide tutoring for them, and then to sort of expose them to the outside world and just give them opportunities to relax and have fun. We also do provide cultural and recreational field trips. And in addition, when we're thinking about the youth and the struggles that they're going to, we will be providing our mentors with ACEs training. ACEs is Adverse Childhood Experiences, and also youth and mental health first aid, and as well as other social and emotional training to help our mentors effectively interact and support the youth that they're working with. So as I said before, the Queen Anne's County Local Management Board is the grantor, but we are currently administering the program. We will be meeting at Kennard African American Cultural Center in Centerville. And this is my contact information. If you would like to make a referral, if you want to sign up to be a mentor, we could definitely use all the help that we can get right now. Oh, and forgot. So the local care team, the transportation voucher. So that is a program that's really great. It can be used to provide personal transportation. Let's say your car gets messed up and you need help paying for repairs. The local care team, the transportation voucher will cover that as well. For youth, if they want to do driver's education, there are funds available for that. We also use the transportation voucher program to provide transportation for our youth from school to site and back to home. So it's a very good program to look into, and you can make referrals from your agencies, in Queen Anne's County to the local care team for your transportation needs for your clients. So this program does not directly involve the youth, but it's something that I'm passionate about, and a goal of mine with the community mentoring program is to share some of the local history with the youth, just to get them a sense of identity and, inform them about their history and where they come from. So I am the coordinator for this project, where we are looking at a community history of the shantytowns on the Kent Narrows. Beginning in the 1930s, when the first packing houses were built, the workers who worked for the CPU packing plants also lived on site. So the owners of the plants provided housing for them to live in. The housing was not great. It was basically a shack. But because so many of the workers were also migrants from Virginia and further south on the shore, they needed to provide somewhere for them to live, to be able to work and go back and forth between their homes and their work site. And all the residents that lived there were Black. They were watermen. Overwhelmingly, also many females worked in these packing plants as well. And there was a whole community that sprung up around the shanty towns. And our goal with this project is to, tell their story. So the program involves oral histories, public research, and eventually this summer, it will be culminating in an exhibit that will be featured at the Kent Arts Center as well. And we are currently being funded by Maryland Humanities and Stories of the Chesapeake.
Right, thank you so much. And Naryah, I'm unable to see the chat while sharing, so I don't know if you can, if there was questions for Yolanda in there.
Yeah, I think we had kind of a broad one, which maybe we'll touch back to on the other one. Actually, no, I guess we can ask it now. So Christine said, could the underutilization of some of these resources indicate a need for better communication across agencies and to the public?
And I can answer that, because I would say yes all the time with some of the information that we have and we share a lot of times. As Brandy said, you can catch her and all of the LDACs across the shore. A lot of the same people are in the same meetings for us that I know who will attend our local drug and alcohol coalition meetings that Midshore Behavioral Health has. So we all have to be more intentional and do a better job with sharing the resources. And a lot of time with resources, though, until you are in need of them, you don't know they exist. You may not have had a need for them, but still, that's why we want to give this information today, so you are aware of the resources and where you can go find them, that you now have names and faces, Eboni, Brandy, Yolanda, Naryah, myself, of people that you can contact to ask for resources. And that's one of the things I do enjoy, is being able to find the resources, or how we can be creative to ensure we have this particular resource. If it has to look a little different here, then that's something we can do. I receive calls and Facebook inboxes for housing resources, where to go, if it's a food pantry, to cars, who can help repair a vehicle and things like that. So we definitely have to do that better job with communicating the resources.
I think it's also kind of on us as community members too. Now that everybody has been here today, you are all wealths of resources as well. So, take on that responsibility to share this information with other people, because that's how it's going to get out into the community.
Completely. And I'll talk about our another program that we have under Mary's Dream Alliance is the Adolescent Clubhouse. The Adolescent Clubhouse is for the 5 Midshore counties. The Adolescent Clubhouse model is on the Western Shore, Midshore Behavioral Health. put out an RFP, a request for proposals to have organizations apply to be able to implement the Adolescent Clubhouse model. It looks at youth 12 to 17, and what we provide are preventative services to deter substance use, opioid use, and to be able to provide positive outlets and engagement for students. And as I stated, our Adolescent Clubhouse is called Club Fear. Our students named the clubhouse, Face Everything and Rise. They wanted a name that would provoke conversation, because when you see the term fear, and so they wanted it to really to flip that to something positive. So we have 2 here on the Eastern Shore, one that serves Kent, Queen Anne's, Caroline, and Talbot, and then our Club Fear South that serves our Dorchester County youth. And as it has been stated throughout the other presentations, what we wanted to do is to not tell youth just to say no to drugs, no to alcohol. We really wanted to teach students to say yes. This has kind of become our motto: a yes to activity and activism, yes to exploration, to collaboration, to curiosity, to leadership, and to mentors, and to the outdoors. As Naryah talked about, her self-care tip was to get outside. And yes to knowing their history, as Yolanda just spoke about, how learning our history, our identity, and Queen Anne's County has so much history. I'm also a native Queen Anne's County as well. And then also yes to careers that they are passionate about. And this list is some of our partners that have assisted us with implementing the Adolescent Clubhouse, the Caroline County YMCA, Harvesting Hope Youth and Family Services, which is also another outpatient mental health program in Dorchester County, our Center for the Arts, Washington College, our mentoring programs, as Eboni, as you would guess, is a partner with GLOW to be able to have the young ladies there be a part of that program. Our health departments have been able to give us the substance use education piece for our programs. And then here is just a review of our Club Fear sites and where we're located. And as we've been talking about, we had mentioned ACEs earlier. Our staff are trained in ACEs, which we just completed another 2 hour of ACEs. And I feel like that ACEs is something anyone working in any public setting should receive an ACEs training. And that is something that for the Sunday supper, gladly to give you ACEs trainers that are able to come and do a training virtually for the community to be able to complete those ACEs trainings and understand what ACEs are. We also are trained in Botman life skills, mindfulness, and strengthening families. And so what we offer through the Adolescent Clubhouse, and what we've kind of taken the motto, and my co-founder, Mr. Paul Tue, his message is that we're taking the medicine and we're putting it in the ice cream, because we're offering behavioral health supports, but it just looks like it's wrapped up in some fun how it's offered. And so we offer workshops on trauma-informed care, life skills training. We're building a podcast studio in our facility in Chestertown. Our youth have been able to go over to Washington College in their podcast studio. We're offering art and music and equine therapy. We have support groups, the psychoeducational groups on substance use. We have our LGBTQIA plus groups that are currently running, and then offering family and structured activities as well. This is our Adolescent Clubhouse staff. And as we stated, we will share this information. And these are some flyers of some of the programs that we've held. We did, it was called a Limitless Group. Our Recovery in Motion staff through the Kent County Health Department was able to assist with facilitating this group. We brought in social workers, finance professionals to be able to come in and talk to the youth through just a range of different life skill courses. And we have our LGBTQIA support group. This support group is for youth across the 5 mid-shore counties. So if something is offered in Chestertown, a youth from Centerville can access that service and support. If something's offered in Cambridge, a youth from Denton can go to Cambridge to that site. Because right now we're virtual. We don't like it. We did have kids on site. In our Chestertown site, we were able to social distance our youth. This month, because of the COVID numbers, we decided to go virtual, and we're losing that engagement when we did that. We could have 25 to 30 youth on site, as you will see from some of our pictures that we have. But with the virtual world, either being able to use a device in the home or internet services, or just being tired of being on Zoom as well. So we will be looking to see how we can bring our students back on site safely. We also offer mindful mornings with MDA, and mindfulness is really just being present. It's just what we have been able to do for Mindful Mornings. Paul, too, is who facilitates our Mindful Mornings. He will be able to go into the school, and I believe he's done for Queen Anne's County Mindful Mornings with Dad with Miss Enzer, that she's had him into the schools to be able to do the Mindful Mornings. He produces an affirmation for the students. They can get on the call. They do not have to say anything when they join the call. When he hears the beeps, that means the kids are there, ready and willing. So then he begins that call. And for, I believe, tomorrow morning, he will actually be in Kent County Middle School at 8 o'clock in one of the classrooms doing a Mindful Mornings. And this was an art session that we had at our site early on with our students, as you can see. And here they're being guided through an art activity. And also what we provide, Recovery in Motion, was also on hand to be able to give still that substance use information to all who attended. Parents are always welcome to attend with their students for any of the activities that we provide. We also offer a study hall, and that also we, for the month of January, that we decided to hold off on doing the study hall, but it is a drop-in time for students to come in and to get that additional homework help. This is another place where we can use volunteers and tutors for these services. And we've been able, what the students have on now is the virtual reality headsets. And so a cell phone is placed in the headset and they're able to just really be immersed into many different places with this. The virtual reality can help, as the slide says, with PTSD, anxiety, and depression. And one of our past offerings last summer that we were honored to be able to assist with Washington College held at our site to be able to produce a hip hop time capsule. And this was youth coming together to be able to present and to create at the end a mixtape, which it lives at the Chesapeake Heartland's website. But they were able to come into our site Monday through Friday for 4 weeks. They had to interview for this internship. They had to go through application, interview, and then be selected for this program. They were paid $13 an hour to be able to attend. So we know for $13 an hour for our high school students, that meant being able to take care of their school supplies, school clothes, to be able to give back into some of their homes, is which some of our students would have to do. We are bringing this back this summer, and I have been completely charged with making sure our students from across the Midshore can participate. This was really just having music on site every day to come to work, and you have someone playing an acoustic guitar, or they were making beats on site. We also had other musicians from around the country that were able to come in and Zoom in to this hip hop time capsule for our youth. And this is the website where the mixtapes land. One of our MDA youth board members participated in the Heartland project through the hip hop time capsule. And then for us, some other partnerships, again, the outside and how it's just so important. And you see my notes here, I had to change to this slide, so since it wasn't advancing, but we had our youth be able to go out in the canoes. And for some of our youth, and for me, it produced some anxiety. So first we had our board members and some of our staff go out first in the canoe, so we wouldn't project that anxiety on our students when we got them in the water. And so we were able to go out and work with the Sultana Education Foundation, and they have been intentional about access to diverse groups. They have met with us to discuss when they have school field trips, you can have more diverse students on site. However, when it comes time to camps, that they do not have the diversity in their camps. And one of the things we look at is the cost of camp, and then being able to relate to who is at the camp and those counselors that are there, and then the fear of attending these camps. Some of our students, we were pulling and tugging them along to get in the canoe and just having that real fear. of that, in fear of not being able to learn how to swim. We did this presentation down at Salisbury University, and one of the questions we asked then was about, do you remember the first time that you learned how to swim? And overwhelmingly, from the minority students that were in the room, some of them had never learned to swim. Our students of other races were like, yes, sure, I've been swimming forever, but it goes back really to that access piece and the fear for us for the water. So that is our goal, to be able to engage our students in activities that they may otherwise not have the opportunity to participate in. When we go back to our history projects, this is a picture of our students at Sumner Hall. Sumner Hall is located in Chestertown. It was one of two places for soldiers coming home from the Civil War. The other one is located in South Carolina, but Sumner Hall has teacher trunks. So for Black History Month coming up, any month coming up that you're able to infuse Black history lessons into your programming and into lesson planning, this is a great resource. They have just an extensive collection of items, and they're available to school systems to be able to use, but this is their teacher trunks there. We were able to take students on site. They did some drumming, call and response, singing, scavenger hunt while we were there on site, but also another great resource for students to participate. And here are students in equine therapy visits. And so we've been able to have our students go out to the farms, and as it says on the slide, the benefits of equine therapy to reduce anxiety, lessen feelings of depression, increase self-esteem, better impulse control. And again, being out with the horses, some of our students have never been that close to horses, but they soon gain relationships with the horses. And finally, as we're narrowing down, we do also have a garden project at Lucky Pick Farms, and everything was growing there during the growing season. We will have our youth and students and families back out to the garden. We are a Chesapeake Heartland Fellow, meaning that we receive funds to be able to have this project, have the gardening project, work with the elder in the community and a youth, and be able to, at the end, what the exhibit here will be is a story and photographs, recipe tasting, and a gallery showing at the end of this. And this is one of my favorite pictures of our students that are at our site in Chestertown. It's just a great picture of what the Eastern Shore has to offer to all of our students, and that all of our students should have access to the wonderful activities and things that we have here on the shore. And Naryah, and that is it for our presentation portion. I do see, I was trying to get through, there were about 3:45, and so to have time for any follow-up questions and any next steps, and where do we go?
Yeah, stellar presentations. It's amazing to see such a comprehensive wealth of resources that we have in our county, and all the dedicated work that's going into serving our diverse population. So big snaps to that, to everybody for their presentations. And I'm also going to do a proud plug that Naryah's Dream Alliance is a nonprofit organization, so highly recommend giving them a follow on social media, or checking out their website to keep tabs on what you can do to contribute your time or your talent to everything that's going on there. Because it seems like y'all literally have just, you're in every single community. It's incredible. So you guys are so inspiring. A little bit of a fangirl over here, but anyways, we're going to jump into our question and answer portion. You're welcome to submit the questions via chat, but I think we could also probably unmute ourselves. You know, if you have a question, unmute yourself and pop in with a question. So I will leave the floor out to everybody if they want to jump in.
I have a comment and some questions. I wanted to congratulate and thank all of the presenters. You guys made an amazing presentation. I have to agree with Carol Franks Randall. She posted incredible resources in one of her early statements, and that was less than halfway through the presentation. Yolanda, you mentioned something that got my attention, and I know it got Jack Broderick's attention too, because we were trying to figure out who hosted the Shantytowns event that was held at Graysonville Community Center. And I made several phone calls. One was to Jack Broderick, who's president of the Kent Island Heritage Society. and I called some other people there in the community, but nobody could give me your name or anybody else's name. And my editor saw a posting about that on Facebook a couple weeks after it happened. We didn't even know it was going to happen, but we want to know about it going forward. So if you need my information, we can exchange information on that.
Yes,
And
please.
I didn't hear, I heard about all of these resources for crisis intervention teams and so forth, but I didn't hear any of you say anything about, it's kind of like if you see a crisis or the potential for a crisis, what should people do? Because I'm going to be writing a newspaper article about this. What should they do before the dam breaks? You know, what should they do before there's an actual crisis, a life and death situation? And I don't know if that's possible, because I did hear things like you can't get any help unless a therapist writes a report that you need help. But there are people in our community, particularly youth, who we see tragedy on its way. And how do I say that in an article to say that you guys are also here to help prevent a tragedy from happening, not just cut it off when it's about to explode?
Okay, Doug, and thank you so much for your questions. Brandy has her hand up, and I know Ebony's probably hot on the trail, and I was going to answer as well, but I will defer to Brandy as our crisis management provider to answer that question.
When talking about youth, I've sat in several different meetings over the past week in different counties, and the same question about youth in crisis and how to prevent them. One suggestion that I would make is that if you have access to youth, utilize mental health first aid for youth. There's instructors out there who could do instruction with youth on the signs and symptoms to recognize in mental illness and those crisis situations. And it also gives resources, local resources, nationwide resources that youth could utilize in those instances. And it not only does it help them recognize it with their self, it helps them to recognize it amongst their peers as well. I think that's a great resource to utilize to help kids ahead of time before it happens, is to educate them on what to look for, what are those signs and what are those symptoms, and also giving them those education pieces on resources that are out there. You know, there's a text line available for you. You know, there's different hotlines here. There's different places that you can get help from. Not necessarily that you have to have a therapist, you know, give you a diagnosis, but there's resources that you can access without a therapist recommendation. So that's my spiel on things that you can do, is to be proactive versus reactive.
I definitely, just to piggyback off what Brandy said, definitely looking at signs and symptoms. So like if you or someone is working with the youth and they see that they're, you know, isolating, there's, you know, no motivation, irritability, just something different from their normal baseline, then I would definitely suggest that someone just go talk to them, or, you know, not ask them what's wrong with you, but what is happening around you, so that you don't put it so much on that person so that they don't feel like something is wrong with them. And they may be willing to talk, and maybe you can have a coach or a friend or a neighbor just reach out and then figure out, okay, what resources are available to help this person.
Thank you both so much. Doug, hopefully that answered your question. And Ebony, myself, or Brandy would be more than willing, if we needed to speak to you offline and offer this platform to flesh out some of that information. I know you said you were writing an article, and I do want to get in some of the other questions as we are about 10 minutes to the hour. Miss Gail Renborg. Okay.
I just want to say that despite the fact that I'm spiking a fever and feel like the devil, I just felt this was so valuable to do today. I appreciate everyone's time that's been put into this. It's given me a lot of places that I can investigate to see what I can do as an older citizen. Just of great interest to me, always has been. And I've found that throughout the years, I moved here as a young mother and lived in a trailer with my son. And the area is incredibly diverse, but I've always been concerned about the youth in particular, because there have been very little outlets for them. And even just talking about boating or swimming or horses or, anything, when all this is here. So I just really do appreciate all this information, and I'd like to find places where I can contribute what I can contribute to an effort to make things better for our young people.
Thank you. Thank you so much. We definitely appreciate it. I'm going to ask Commissioner, please pronounce for me your last name.
Corcorino.
Okay, I wanted to add some other letters and syllables and things in there that was not, I've heard it before, but I really wanted to give you and the other commissioners just to thank you on this platform, as you all provided a support letter for our Shantytown project. So Mr.
Absolutely.
Doug, the commissioners are aware about that program. They provided a support letter for us to receive funding from the Stories of the Chesapeake. So thank you so much for seeing value in that program. And we will actually see you this week, I believe. We're coming for the mentoring proclamation. So we will be at the commissioners meeting this week for Queen Anne's County. But thank you so much. Just wanted to thank you. Say it one more time. I'm sorry.
Yeah, Doncella, Jack Broderick here. I wanted to affirm what Doug said and what the commissioners have backed. But you and I talked briefly, I think, last year about your project.
Yes.
I want to affirm the Kent Island Heritage Society support and doing whatever we can do to help bring that project to fruition. It's a really important part of our local heritage here and a story that really needs to be told. So thank you.
Yes, thank you. Thank you, Jack. Go ahead, Yolanda.
Yes, Jack, thank you for that commitment. And Doug, can you both pop your information into the chat box or direct message me, please?
Got it.
Sitting over here thinking about how we can pull from you guys for future Sunday supper discussions and presentations. There's just so much going on here, especially with the Shantytowns, Yolanda, that really interconnects to what we do with the Sunday supper, because this is kind of, like we said, this is kind of an offshoot of what we normally do, but we're really glad to have had this. And I think from here, this can be kind of a stepping stone for us to get into more, mental health and behavioral health facets. So.
And I see Naryah, Frank Draper has a hand raised.
Hi, I just wanted to say a couple of things. One, thank you so much. I appreciate you sharing and taking the time out of what is obviously a very busy schedule. And I just wanted to quickly, I know we're running out of time, acknowledge one of the steering committee members for the local NAMI chapter, Bill, who I think was going to share about a new resource that will be starting next month locally.
If I could just take a second, the NAMI, National Alliance on Mental Illness, and Kent and Queen Anne's has a local chapter of NAMI. One of the things that came out during this presentation, by the way, it was wonderful, was how intense the needs of some of our youth are. We shouldn't forget that some of our families have huge needs as well, and family support is really critical. So what NAMI is doing is we're starting one of our family support groups next month. It's going to be online, and it is not intended for parents of younger kids. I wish it were, but we're looking at probably high school age and transition age and older. Having a family member with a mental illness can just be devastating and very, very stressful. So this is a peer-led group which will provide information, but also be an opportunity for sharing. And I'm just going to put the information in the chat, and then folks can contact us if if they'd like more information about it. So thank you.
Frank, did you have any other comments that you wanted to continue with? I know that you mentioned kind of getting some mental health first aid training. I think that's an excellent idea, and maybe something that, again, Sunday Supper can help facilitate. So we'll see what we can get out through that.
It was a wonderful training. I did have to travel pre-pandemic. I think I went all the way to Berlin to take that training. I have not taken the youth training, but I was wondering if this also may be a great resource for teachers and others in the community that we could help support locally.
Yes, and Brandy put in the chat information for first aid, mental health for youth. We Maryland Rhoda also offers. You can go to their website. They offer tons of trainings, and that is one of them. And our organization just completed the youth first aid mental health trainings, and it was virtual. So they are doing virtual trainings. But
And
that's Maryland. Go ahead.
No, I was going to say, if you go to Midshore Behavioral Health website, they have their newsletter that lists trainings weekly. I think weekly. So they have all the trainings in there as well.
I just want to say the faith community is doing the first aid mental health also in the next week or two. Joan Brooks was, she kind of gave us an invitation to come. Mm-hmm. But the first one is for adults, and there's going to be a latter one for adolescents or young. So,
right, and that's yes, Miss Mary, and that's falling under that Midshore big umbrella. Joan is also a Midshore Behavioral Health Board member and brought that to the board, to the importance of including the faith-based community in behavioral health awareness. So that is another item workshop that Midshore Behavioral Health kind of covers to make sure that it's done in the community. She mentioned in training, and then it happened literally the next month that they were advertising to be able to do that workshop for our faith-based community members.
Awesome.
All right. Well, I just want to thank you. I didn't know if Brandy or Yolanda or Eboni, if you had any final thoughts for our panel, for our participants. We will put resources together and get to Naryah what we've talked about, so you will have those that information available.
Thank you guys again so much. This was just like dazzling. Feels like a really cheesy word to plug in here, but really truly I'm so impressed with everything that you guys are doing and that what's provided in the county. And just to circle back to it, like everybody who's been here, you guys are now the resource. You have the resources, so start getting them out to everybody. And also Christine just chipped in with, please volunteer. Like, these community assets are only as strong as everybody who's involved with them. So everybody, run, don't walk towards your nearest ability to volunteer with everything. So
Naryah, if I could just add in, so people learn a lot about a lot of the resources here. And I think that a lot of people in the county, I think it was said earlier that until you need the resource, you can hear about it, but you're not really going to know where to go when you need it. So everybody who participated today, when you're talking with people in the community, just remind them, tell them about this event and remind them of some of these Midshore Behavioral Health, the different groups that are out there that can help them. Because the more they talk about it, people will know that the resources are there. The thing I encounter the most in the county is people, when they have concerns or complaints about something not existing, they don't realize that it does, and getting the information out. So you all are sort of diplomats on this now. So go out and do your mission.
You heard it from the commissioner himself, guys. Get our job.
You have to now. You have to do it now.
All right, everybody. Well, thank you so much for being here. Again, this is just fabulous. And we look forward to seeing you again at other Sunday Supper events and in other places in the community. And we hope everybody has a safe and healthy weekend, or for the rest of a couple hours you got left. So take care, everybody.